Okay, great. Okay, okay. Hi, we live. Great. Hi, this is Malik Khan. I'm a licensed acupuncturist, herbalist, and nutritionist. I'm interviewing my colleague and friend from Austria, Dr. Daniel Schöpf. Have I got the correct set?
Yeah, it's correct. Thanks.
Okay, great. From Acupuncture Praxis, Kitzbühel.
Yeah.
Okay, who's a licensed acupuncturist, a medical doctor, and he specializes in neurological conditions. Thank you for joining me today, Daniel.
Thanks for your invitation. I'm very happy to be here.
Thank you. Okay, let's just start off with you're a medical doctor, and you're also now specializing in, or you have been for quite some time, in TCM medicine. What made you choose TCM?
During my studies in Innsbruck, in university, I felt all the Western medicine is very good, but there is maybe something more to help my patients to get relief of especially pain and other conditions. And then I started to attend lectures about acupuncture there, and did this special diploma in Austria from the Chamber of Medical Doctors. They offered the diploma, and I finished that diploma, and then started to getting more and more into acupuncture and doing courses all around the world, especially on neurological conditions as well as like headaches or so, and yeah. And I'm working in a rehab center as well in Kitzbühel, and there we have lots of patients with orthopedic on traumatic conditions. So, for example, after a hip surgery or knee surgery replacement, or people after accidents, they come here and do the rehab center, and I support them with doing acupuncture. So I'm seeing a lot of people there doing acupuncture, as well as seeing lots of people in my clinic.
Great. And so you combine Western medicine with Chinese medicine as well, with acupuncture.
Yeah, mostly acupuncture. That's what I'm focusing on. I have not that herbs education like many others have. I'm focusing on acupuncture, and I experienced that I can help them quite a lot, the people with their conditions. Sometimes I do like some herbs from the local area. Based on a TCM diagnosis, they get some recipe for some tea, and that supports my treatment, for example, for migraines or menstrual disbalances or so.
Okay, excellent. And how effective is the acupuncture? What results do you get?
There are always conditions which are very easy to treat and conditions which are harder to treat. So my experience, I have very good results with headaches, with gynecological problems due to lower abdomen pain during the period time for women, and having good results with pain in the joints as well as in the back. So these are like the conditions which are generally said successful to treat. Although I can't say that I can help anybody or everybody, because I think nobody can deliver 100% efficiency with no treatment. And no matter if Western medicine or acupuncture, Eastern medicine, or traditional medicines from around the world.
And did you say that you specialize in neurological conditions?
I did this special course from Dr. Ming-King Su. He developed this Su scalp acupuncture, which are small needles with a diameter of 0.2 millimeters and a length of maybe 1.5 centimeter, which stick in the scalp. The scalp is like this tissue over the skull, so where the hair sticks in. And he developed some rather easy to learn acupuncture style, but very effective, especially for neurological conditions like paralysis or any like pain, nerve pain or so, which is also possible to treat with the normal acupuncture, but this special scalp acupuncture, due to the veins which go from the tissue through the skull near the brain, can activate the brain and can help the brain restore its normal function to reduce the pain and getting movement, for example, for a paralyzed extra limbs, or also reducing like the shivering of a Parkinson patient can be reduced as well with the scalp acupuncture. And this acupuncture style is a little different because the needles are not stuck in like vertical, but they are very in a light angle for about 30 degrees. And the needles, since they hardly do any pain, they can stay in there for 2 or even 3 days. And the patient can remove them itself, and the needles can be stimulated several times so that the efficiency is extended. And
are there any? Yeah, sorry, go ahead.
And one important thing about this scalp acupuncture is not only the acupuncture, but also the patients needs to work out very very hard. So the needles will do their job, but the patients need to do at least 50% of the job as well. Like it's called the Daoyin. They are stimulating the area, like moving the leg passively or trying to move actively, or at least with thoughts. So if you're not able to move it in the beginning, you need to think about it very hard to move them and to stimulate the paralyzed limb, for example, and then there can be improvement as well.
Do the needles have to be stayed in when they try to move around, or
in the scalp, in the head, so that won't disturb you anything? So people can sleep with the needles in the head as well. I did it on myself as well. So I didn't even feel them. That's the great advantage of the scalp acupuncture. It works on the extremities as well, but the needles are on the head and not staying up like this, that people can have a strange look at you, or you can wear some head or so, but they are very, how do you say, in a small angle, that they will not disturb you while sleeping, they will not disturb you while working. So you can do nearly everything with the needles in there, and the efficiency is prolonged.
okay? And if you what about children, say 12 years, 15 years old? Can they have this as well?
Since the needles are very small, they can have them. I would, Dr. Su did even with babies, but I would be very careful with babies, especially in the front area where the fontanelle is. There's no skulls yet. But the children in general in acupuncture, they react, how do you say, very strong to, or as well to even light stimulation. So Dr. Su sometimes just puts needle in and out. I personally did not acupuncture on the head for babies or so, but there for children or babies, I do shonishin. It's like a Japanese style of acupuncture where no needle needs to be inserted into the skin, but it's like stroking, tapping, knocking, and pressing to points, and the vessels, the meridians, and they can have good results as well for the children. Like had 2-year-old children with problem with the immune system, not severe problems, but always getting sick and getting a cold, need to take antibiotics several times a year, and did the shonishin for several times. And then the big advantage of shonishin is that you can teach the parents to do it, so that the parents can do it at home and they have a good feeling that they can help the babies without doing any medication if it's not necessary. And that I had a great success with this as well. Yeah.
Great. And how many treatments would you need with Dr. Zhu's scalp acupuncture generally? How many treatments do patients need to have?
It depends on the condition they have, and you can also treat for people sitting in a wheelchair or after a stroke, getting hemiplegia or so. And in general, the rule is the earlier the better. So if they have had a stroke a few weeks ago, then start immediately with the treatment. Then you need to be very continuous with your treatment. So the patients need, they really need to want it as well. So if they can think about, oh, I go 5 times acupuncture and my paralyzed leg will be okay, that's not, that would be a nice wish, but it's not going to happen. So the work ethics must be very great from the acupuncturist and from the patients as well. And we need to have a plan. This can go on for several months or so. But the advantage of the scalp acupuncture is that you will see at least a little improvement quite soon. So it's for the patients very important that they see a little improvement from a paralyzed leg. Maybe there's some twitching, a small twitching. You can't even move it, but you see the muscle twitching after a few treatments, and that's a very improvement for the patients. And they can see, they can get new hope, and they can get more will to continue treatment as well.
Okay, so people, say paralyzed people in wheelchairs, they want treatment from yourself, so they can stay in their wheelchair when they come to your clinic. Do they need to lie down on the bed or on the couch, or they can stay in the wheelchair and you just have to do it on the heads?
It depends on what condition it is, but normally they can stay in the wheelchair as well. I put the needles in the head and sometimes put longer needles in the extremities for stimulating the deep tissue, okay, the deep nerves. And then so all of a sudden they realized, oh, I still got a feeling in the very inner part of my leg, which I had not experienced before. And I can stimulate this with the needle. And so that's the first step of trying to improve. Although it's the way is quite long to do it, but as Dr. Su and his assistants like James Liu and Moye Siu, they showed many examples of how to bring people in wheelchair to standing up again and to develop some sort of independence and walking skills for themselves.
Okay, excellent. So how many treatments would someone need to get, say they can't walk, and how many couple of months should we see some improvement?
I cannot say, everybody's different, but don't expect wonders within 2 weeks or so. That's not going to happen, I think. Hard work, small improvements, but constant improvements. And it's not the improvements, it's not like a straight line. It's like the indexes of the how do you say, the charts on the DAX or so, and it's like going zigzag, but the tendency should be the right one. The improvement should be there, and over a long time period, you will see the improvements for sure.
Excellent, lovely. So you see a lot of neurological people. So you specialize in that. People with headaches, fertility. You do that as well?
No, I don't. I have had a few of them, but not very much success. I think there are other acupuncturists around who focus on this. Especially in Austria, the fertility acupuncture is just starting, so it's not that big like in America or Australia or so, I think, or maybe the UK. I don't know.
Yeah, and the UK, I think, is quite. It's growing. It's quite popular.
Okay.
Success rate with is quite good. So some research.
Okay. Yeah. Yeah.
Okay. So do you see? So you see a lot of children as well. With
Yeah.
the
As well, the children, like they sometimes babies come and they crying a lot and having like gastrointestinal problems. And with the Shonishin, you can smoothen this. You can give the parents some instruments to do it for themselves and their babies at home. Like I do it with some special needles. They're called needles, but they're some sort of instruments. You're not pinching the skin, but you're just superficial, like tapping and pressuring and stroking. Okay, with some instruments, and the parents at home can do it as well, maybe with a fingernail or maybe with some biro or so. It's a very light pressure applied on these points, and it will do a great job as well.
Great, good. So so just to, if someone wanted to contact you, and what would the treatment process be? So they called you, and then what would you do next? Would you have an initial exam, or
Yeah.
would they have straight away, or what would happen?
Yeah. The contact modalities are like this. They can either call or write an email or use the contact form on a homepage. It's www.acupunctur-kids.at, and they can contact me via these modalities, and I will call them back and have a short talk on the phone, and then we fix an initial exam where we talk about the problem, we talk about the procedures we can do, and possibilities of helping the people. And what's my bonus is, as a medical doctor, I can give them advice as well in Western medicine. So I tell them to go check up for an MRI, for example, MRs, or CT scan, or doing some blood testings, or doing physiotherapy as well. And so I combine the Western and acupuncture medicine to give the best treatment for my people. And that can mean that we do an initial exam, and then I say, now do this and that therapy first, and then come back. Or we can do additional acupuncture therapy as well, but you need to do this and that procedures to get better diagnosis, or to enhance the therapy progress. So, and then we can talk about how many treatments would be recommended, or for the first month how many treatment, and for the second month how many treatment, and then we can agree what is necessary, and then we try to come to a conclusion that we're going to start with the therapy plan.
Right, excellent. Well, that's very sort of enlightening and informative, Dr. Daniel. It's great to be with you today, and I hope we can meet again. And I'm sure you've got a lot of other experiences in different fields. We only touched on a few today, so maybe we can arrange another time where you can go again with some of the other modalities that you apply as well at your clinic. I know you get great results. So hope we can arrange another time with yourself. Thank you very much for today, and
thanks for having me.
So great. Thank you very much.
Thank you. Bye bye, Malik.
Bye.